Hi, Colorado PAs. This is Alyn, President of Colorado Academy of Physician Associates, coming to you with another member that we have in our board of directors. I'd like to introduce Alyn Welcher, who is very implemental in helping the governmental affairs as well as Colorado Academy of PAs able to pass and write the legislation on PA modernization. This was Senate Bill 083 that passed in 2023 and is now law. And I'd like to have a conversation with her so that we can educate all of our Colorado PAs on how this adjusts or affects their PA practice in Colorado. So welcome, Alyn. It's so good to see you.
Yeah, thanks so much for having me. I really appreciate you inviting me to talk about this. I actually really love this topic. CAPA has done a phenomenal job modernizing PA practice in Colorado, and I am very excited to share this with all of you and hopefully give you a little more information and some resources of where to find what you need as we move into this modernization phase for PAs in Colorado.
That's great. And thank you for all your work and the committee of being able to meet and talk with legislators to be able to pass this bill to modernize PA practice in Colorado. So just to start off, would you be able to explain a little bit of what collaboration means for Colorado PAs?
I think nationally there's been a huge push coming from the American Academy of Physician Associates appropriately, of which we are a constituent chapter, to modernize PA practice so that we can meet the increasing needs of patients in the country and particularly in Colorado. There's a huge issue with access to care, and there's also been an issue with PAs being to really work at the top of our license to provide that care for patients. I think we all know that the profession has evolved from the 1960s, and these laws are really just a way to reflect what PAs are doing on the ground to meet these needs and the evolution of the profession. So traditionally, PAs were supervised. That meant that you had a legal relationship with one physician, and your relationship and your scope of practice as a PA was defined by the scope of practice of the physician. So if the physician could do it, you could do it. If the physician couldn't do it, were not trained in that skill set, no matter where the PA came from or what skills they brought to the practice, they were not allowed to provide that skill set, and thus access to care for patients suffered. So what we have done in Colorado is that we have changed that relationship. There is no longer supervision. Supervision does not exist for PAs in the state of Colorado. The relationship with physicians or the physician group that you work for is now collaborative. What that means is that the PA scope of practice, what you can do legally, is now determined by your experience and training, by the skill sets that you have, and what you bring to the table, instead of defined and limited by someone else's skill sets. So that is a monumental shift in PA practice in Colorado. There are a lot of other things that the bill did, but I think that's the one key element that people need to embrace and understand. Your scope of practice is based on your training and experience. That's huge, and it is how it should be. So that's really the big difference.
And I agree with you on that. For those of you that might be new to Colorado, you can go to our website, Colorado Academy of PAs.org, and be able to see that collaboration agreement that we have posted, as well as more information. So thank you for that as well. Now, tell me something. If I am been in practice for 7 years as a general practitioner, and I'm now able to practice at my scope, which thank you very much for that. And I am now maybe going to retire into dermatology. What does that mean, or what does that look like for me as a practicing PA?
Yeah, so when we passed this this bill, there were some thoughts from other parties about newer PAs versus experienced PAs.
Mhm.
PAs can thankfully change practices to meet the needs of patient populations and where we need access. So there were also some thoughts about what PAs would need to do as they change specialties. So what that means, if you have been practicing for 7 years, the baseline for PAs in Colorado is 5,000 hours. So some of the requirements that need to be included in your collaborative agreement with a physician or physician group change based on how long you've been in practice. So under 5,000 hours, there are a few minor increased oversight that needs to happen. If you come into Colorado, you've been practicing for 7 years, but you are then changing to a different specialty, there is an additional 3,000 hours where you have to include a little bit more oversight in your collaborative agreement. So I would refer you back to CAPA's website. We spent a lot of time and effort putting together a really comprehensive collaborative plan. It literally is a checklist. You can download it. You can fill it in, you can check the boxes, you follow the flow, and you will have what you need to meet the legal requirements of collaborative practice in Colorado. So it's really simple. We made it as easy as we can be and as comprehensive as we can be. So I would really encourage you to use that document to ensure that you're meeting the laws of the state.
Great. So a couple other scenarios just to talk about as well. So we do have 4 PA programs in the state of Colorado. That is University of Colorado. We also have Colorado Mesa University. We also have Red Rocks Community. We also then have Rocky Vista University. So any of those new students that are graduating and wanting to work in Colorado, what does this collaboration agreement mean for them?
Thank you for mentioning the PA programs. I am a PA educator. In full disclosure, I'm the program director at Red Rocks Community College. I love our students and I want them all to stay here and practice here because they're amazing people. So for a new PA, they have not practiced for 5,000 hours.
Yeah.
They've practiced for 0 hours when they start. So for the first 5,000 hours, they need a collaborative agreement with a couple of extra parameters. There's 3 actually. The first one is that for the first 160 hours, you have to have some oversight either in person or through technology. So you need to have a little bit more of a close relationship. The second one is that you have to put a little more information into your collaborative agreement about exactly what the
Mhm.
expectations are. What will your scope of practice be? Who will you have as a contact list? This is stuff that every new PA should have. This is good stuff. You need to know who your support systems are as you first start practicing medicine.
Right.
The other thing is that after 6 months, you have to have a formal performance evaluation. At 12 months, you have to have a performance evaluation. And then after that, it falls to the normal schedule of your employer. This is also a good thing, right? When you're a new PA, you want to have a conversation at 6 months. How am I doing? What
Mhm.
do I need to do
Yeah.
differently? Am I on track? And you definitely want to have a conversation at 12 months. I also think that every PA should have a conversation at 6 and 12 months to review their salary, but that's me. So that's another element of this. So this is good for PAs. It's good for new PAs. But again, I will stress that there is no supervision in Colorado.
Yeah.
They did name this agreement for newer PAs and some other PAs a supervisory agreement, but it is not supervision. It is
Mm.
always collaboration. It's the red agreement versus the blue agreement. It's just a name. It does not mean you're supervised. It's always collaboration.
Great. Thank you for that clarification as well. Just one other scenario to throw into the mix. If I am an ER PA and have been in that field for quite some time, and I work particularly with level 1, level 2 trauma, how does this bill impact my practice in that regard?
Yeah, so that was another area where people had some input into making sure that PAs are safe where they're practicing, particularly in level 1 and level 2. That was a negotiation. There's a lot of negotiation that happens with laws. That's part of the process. People come to the table and they compromise. So with level 1 and level 2, that is a pretty high level of acuity for patients. Anyone who works there knows that. So PAs who work in level 1 and level 2 trauma centers and emergency departments, they have to maintain that other agreement with a few extra parameters. But really, most of those parameters are really about that initial first year. But if you're a PA working in a level 1 and 2, your collaborative agreement does need to further define some of those elements. You know, who's your people that you talk to? What is the nature of your practice? This is stuff that you sit down and talk about when you have your yearly review. You just jot down what you're talking about, what you can or can't do, or what's appropriate, and you move forward. So it's really not onerous. And again, it is not supervision. There is no supervision for PAs in Colorado. I can't stress that enough. I think the law can be a little bit confusing in that respect because they throw out the supervisory agreement and the collaborative agreement, but it is not supervision. So that's really what that means for people.
So collaboration, that is what we are about. And as a PA group, we are collaborators. I think that that's really an identifying title when somebody asks me, what do you do? And I get to say I collaborate, whether it's with patients, with providers, or both. So that's really important. So thank you for that. Just a quick question in regards to next steps. It doesn't have to be long or lengthy because I think that there's some rulemaking that has to occur, but just kind of for those of us that are questioning, what do I do now? Is there any advice or information you can provide us?
Yeah, I think what PAs need to understand in the state now is that there's two elements to this. There's the law. All medical practice is defined by law, and it's always state by state, and PAs are no different. So you do need to know the law. We also have that linked on CAPA's website. If you have confusion about how to read the law, because it is a little bit of a skill set, there's people at CAPA that can help you. Then the next part is that laws pass, and then the Board of Medicine develops rules. Those are rules that we all have to follow to maintain our license. And they are really, really focused on patient safety. So you do also need to read the rules from the medical board. It used to be Rule 400. I think PAs are really familiar with that. But you do at this point need to follow the law also, because you'll notice that the rules refer back to statute. So you sort of need to have both now. You can't just read the rules and know what you need to do. So rulemaking is also another process that CAPA is very involved in. Rulemaking by the board is interpretation of statute, and there's a little bit of leeway or wiggle room there. So it's really important that we, CAPA, who helped write that legislation and understand it in and out, really help the board also interpret that and make sure that they are following the intent of the legislation. So that's what I'd recommend. And again, there's people at CAPA that can help you with this, and all of these resources are on our website and pretty easy to find. So
that's great. Thank you so much for that. Before I let you go, is there anything else that maybe we need to discuss that I did not talk about?
I guess what I would say is that this work that we do at CAPA really is the joy of our lives.
Agree.
Yeah, we are really doing important work and really making progress for our profession so that we really can take care of patients and practice to the top of our license and really do what we need to do for people. So it's challenging work, but it's really meaningful and it's really important for the profession. So if you at all want to get involved, please do. We are always open to having people do this. And I also want to say that CAPA is the only organization that is actively advocating for PAs at the state level. So if you like what we're doing, please get involved, join CAPA, do what you can to support this process. It's really important work, and it's going to have a very meaningful impact. And I would say too, that if we are going to have equity with the nurse practitioners in their practice laws, this is what needs to happen. And we are working towards that and have made giant steps in that direction. So
Agree.
yeah.
Well, thank you so much for all of the hard work that the governmental affairs and all of CAPA does. I am part of that as well.
You are.
But for the most part, appreciate what you're doing. And thank you very much for this information. So Colorado PAs, please take a look, and students and pre-PAs, take a look at our website and let us know if you have any questions. Always happy to assist. And if you're interested and agree with what we're doing, jump on board. If you don't agree with what we're doing, jump on board. We need that collaboration. We need to understand what is going to most benefit all of our Colorado PAs. So thank you again. And Alyn, we will sign off at this point in time. So take care.
Thank you.